It's designed for public education. So there are some folks back there and at the other end of Pennsylvania Avenue who need a little education. And we're going to make sure they get that education when the semester ends later this year, and that education will serve them all very well in their retirement. Because they are headed for retirement. Believe me. I'm not just predicting that, I'm telling you that. After 30 years, I know how to read those polls. Now, the issue we're talking about today is health care, and it is not, life, liberty, and the pursuit of happiness. This isn't pursuit of happiness. This isn't about liberty even. This is about life. Now, some of you may be pro-life, others may not be, but can't we all agree that we're pro-life to keep somebody alive when they're alive, whatever a federal bureaucrat says?
That's right.
Can't we all agree that we live until the medical profession can't keep us alive and God says it's time to die without asking Barack Obama? This is truly the most fundamental issue. When Obamacare was first introduced, I worked on a speech and an ad that we ran around the country which said, how can you treat 30 million more people without any more doctors? And the real question is, how can you treat 30 million more people with fewer doctors? Because of retirements and cuts in the reimbursement rate and the increasing enslavement of American doctors. How can you do it? And the answer is the only way you can do it is by dumbing down the quality of medical care until it is so low that it's not recognizable anymore for anybody for any amount of money in any situation. And that's not acceptable in the United States.
That's right.
I mean, there is a word here, it's the most heinous, obscene, four-letter word in our language. And oddly enough, it's one they don't fire me at Fox for using. It's called QLYS, Q-L-Y-S, QLYS, Quality Life Years. And what they do is the federal government now has all of your personal medical records. It knows for each one of us what medications we've ever taken, what hospitalizations, any prescriptions we've ever had in our entire lifetime, any hospitalizations, any diagnosis of anything, our current weight, our current blood pressure, our current height, all of that stuff is now in the computers in Washington. Not in violation of the law, required by this law. And what they're going to do is when one person in this audience, well actually, as I look over this audience, none of the people here are over 65, particularly not any of the women, so this probably has no applicability to any of you. But when somebody comes in here and says, I need a heart bypass, or the doctor says she needs a heart bypass, they look at the medical history and they figure, without ever meeting you, without ever talking to you, without ever talking to your doctor, how many QLYS does this woman have? Well, she's 83, she doesn't work, she's retired, she has high blood pressure, she used to smoke, and whatever. She has 4 more, she might live for 6 years, but in our judgment, only 4 of them are quality years. And our guidelines say you can only spend $30,000 per quality year. And this operation is going to cost $300,000. She only has 4 quality years left. That's $70,000 or $80,000 a year. Denied. Denied. And it doesn't matter if you're talking about someone that has paid taxes into Social Security and Medicare their entire life. It doesn't matter if they're an American citizen. It doesn't matter if they fought for their country. None of that matters. All that matters is what the statistical tables say. If you get cancer, you probably want to be treated with Avastin. For breast and colon cancer, the drug of choice. In Canada, they don't allow people to take it. Not because of health reasons, but because it's too expensive. It costs $75,000 a year. And if you're 80 years old, you're not worth $75,000 a year. The federal bureaucracy has decided that your human life is not worth that. Obama disingenuously says there's a red pill and there's a green pill, and they each can do the same thing. Let's give them the red pill that costs half as much as the green pill. That is an absolute total lie. It is not what this is about. What this is about is making judgments as to who is entitled to what life-saving surgery, who's entitled to a hip replacement, who's entitled to a knee replacement. I'm sorry you'll be in a wheelchair for the rest of your life. I'm sorry that that's going to cost you 3 or 4 years of life, but it's too damn bad. You gave us that power, and we're exercising it under the terms of the Affordable Care Act. And if you're a young person, as so many of you are, then the issue is a little bit more immediate. It's, do you want to give away 1 month's income in taxes to pay for Obamacare? No! 1 month's income. Either that you have to pay for health insurance before any subsidy kicks in, or as a tax that you have to pay for not having health insurance. Oh my God. I am so sorry. Tim's gonna come down on me like a ton of bricks. I used the word tax. We all know it's not a tax. We all know that it's a penalty.
That's right.
It's a fine. It's an incentive. It's an inducement. But it sure as hell isn't a tax.
It's a ripoff.
You know how I know? Because President Obama promised not to raise taxes on anybody making less than $250,000 a year. So obviously, it's not a tax, because he wouldn't break his word. And when the Wall Street Journal says that 75% of the cost of Obamacare would be borne by those making less than $120,000 a year, joint family income, they misunderstand it. They think that's a tax. But you know, if it walks like a tax and talks like a tax, and Justice Roberts says it quacks like a tax, he's a pretty good quack himself, then it is a tax.
Right.
And it's a tax that they're going to impose on young people when they're just starting out, just trying to pay off their student loans. Now those young people may need health insurance, not because they're sick, they're best of health, not because they have children, they're already covered under the SCHIP, the Children's Health Insurance Program that Bill Clinton and I helped develop. She didn't. But because they might be hit by a bus or run over on their way to a Tea Party rally. And in that case, they need catastrophic health insurance, which is very cheap, not expensive, $1,000 or $2,000 a year, and if you want, just give it to them. Don't ruin our whole healthcare system over that. Don't make them buy the soup to nuts policy that a person of my age would need when they don't need it, don't want it, and can't afford it, and don't force them to buy it.
Yeah.
Then there's the worst tax of all. This is a tax on sick people. Literally, the sicker you are, the higher your tax level goes. This is called progressive taxation, new style. Right now, you can deduct on your income tax all medical expenses beyond 7.5% of your income. He's raised it to 10. So that means if you have somebody who is so sick that basically 1 out of every $12 of pre-tax income, 1 out of every $5 or $6 or $7 of after-tax income goes for their medical expenses, but not more. They can't deduct that. They lose that benefit. You got a pacemaker, it's taxed under this law. You need a hearing aid, taxed. You need a prosthetic limb because you served in Iraq and you gave your leg or your arm for your country. We're going to tax that prosthetic limb. That's our way of saying thank you very much. Now, Justice Roberts upheld the individual mandate, but that imposes an individual mandate on each and every one of us. And that individual mandate is to work like crazy to educate the American people to the dangers of Obamacare and to let them figure out on their own, because this is a non-political rally, how the hell we get rid of it. Thank you.
Thank you, Dick Morris. You know, we got to run Dick Morris for office one day. What do you think about that?
Yeah!